Yeah, most physicians today are just generally confused about the guidance that's coming out. How are they going to interpret this? But a few of them are saying, we're going to keep continuing on as normal, keep talking to our patients about what works for them, what doesn't work for them.
One thing that's interesting here, and we're going to be speaking to Dr. Todd Ivey, a fellow in the American College of Obstetricians, in just a minute. The organization is out with a statement that says it's irresponsible and still what they heard from President Trump and still recommends Tylenol during pregnancy. How atypical is it for a professional group such as the Academy of the American College of Obstetricians to recommend something that's counter to something that a government body such as the HHS would suggest?
If you asked me that question a year ago, I would say very abnormal. This year, this is like the second or third time a American medical organization has gone against the advice of HHS. Notably, we've seen ACOG do different advice than HHS on vaccines, specifically for pregnant women and taking COVID vaccines.
All right, well, I want to put that question to Dr. Todd Ivey. He's fellow in the American College of Obstetricians, which is the professional membership organization of OBGYNs, and associate professor at Baylor College of Medicine, former president of the Houston OBGYN Society. So, Dr. Ivey, weigh in on this. If it's recommended that maybe pregnant patients don't use Tylenol, I don't know, a recommendation from the government, how do you read it? Would you not recommend it to a patient?
No, actually, I would absolutely recommend it. When we look back at the data, and this has been looked at, remember, we have over 20 years of research around this. There's never been proven causation for acetaminophen to any neurodevelopmental disorder during pregnancy. However, we know that the uses of acetaminophen in pregnancy for chronic pain, persistent headaches, and particularly fever reduction are incredibly important. And not dealing with those issues can lead to additional complications during pregnancy.
One thing I want to ask you, Dr. Ivey, and I've seen this certainly in the OBGYN area, that your medical malpractice insurance is off the charts. And I'd had an OBGYN who talked about $1 million a year and gave up the OB part of it because it was so expensive. What I'm curious about, though, is if you have a government saying, maybe you shouldn't do this, does this potentially put you guys in a legal situation or a legal quandary where you could be more of a target if something bad happens?
Well, that would be a concern for any of us. However, I think it's important to remember.
But you know what I'm saying? If the government's coming out saying, maybe you shouldn't do this, and you guys say, nope, this makes sense, we've seen the research, the study, and then something goes astray, is there kind of, a new twist in all of this now in how you might approach something? Or are you still going to say, nope, it makes sense, I'm going to do it?
Well, you would have to prove causation. Okay. And I don't think that's able to be proven. And looking at the highest quality data, the best study designs, it's never been shown to be linked. And so I don't think that would stand. Certainly that would be a concern because we always want to do the right thing. That's really important to us, but I think it would be difficult to prove.
Well, speaking, Dr. Ivey, of the causation doesn't always equal association in some of these studies. Talk to us about some of the studies that the Trump administration pointed to yesterday as the reason to come out with these new recommendations.
Well, there's been questions around this for a long time. And what we've seen, even the Society for Maternal Fetal Medicine and the FDA itself in 2017 and 2015 did reviews and did not find any causation. However, there was a consensus statement that was released in the journal Nature that suggested that maybe there could be some type of link. Well, 10 new studies have been released since that time that have clearly refuted this. The best study, I think, is the one released in the Journal of the American Medical Association in 2024, which looked at over 2.5 million children 2.5 million. And they actually took into account some of the confounding variables that the poorly designed studies did not. And so they actually took siblings and matched them for a control group, meaning one sibling would get the Tylenol in utero, and one sibling would not. And it proved there was no relationship that was proven.
I just want to mention Kenvue coming out over the weekend with a statement on this. They said, quote, this is the parent company of Tylenol, quote, "We believe independent sound science clearly shows that taking acetaminophen does not cause autism. We strongly disagree with any suggestion otherwise and are deeply concerned about the health risks and confusion this poses for expecting mothers and for parents." Dr. Ivey, the president said yesterday, he suggested that pregnant women should they should only use Tylenol to control a fever if they can't tough it out. From a medical perspective, and those are his words, quote, "tough it out." From a medical perspective and a medical communication perspective, I know that medical students study medical communication. How do you look at messaging such as that coming from the leader of the country?
Well, I think that's a very unfortunate statement. I think pregnancy can be very difficult for some women. And I think telling them to, quote, toughen it out is really a poor approach. Now, I think before any medicine is taken during pregnancy, whether it's an over-the-counter medicine or a prescription medicine, a conversation with your healthcare provider is in order. And if they see fit, then I think you need to take the recommended dose for the shortest amount of time. And again, no more than is recommended.
You bring up autism, anybody brings up autism, and it's a very difficult situation. It's a spectrum. I know individuals who have kids who are now adults who are autistic, and it's a difficult thing. And I think we're still trying to figure out what is the cause, what are, the causality, what are the connections, genetic or otherwise. I mean, how do you think about autism, and I'm sure you've seen it, unfortunately, in some of the folks who have had kids. I mean, there's a lot unknown, correct? And I understand everybody's looking to try and make sense of it, but I'm just curious, what's the smart medical thought around autism?
I think you hit the nail on the head. There is a spectrum. There is a lot that is unknown. There's a lot more that we need to find out about it. We know that it is a disorder of the way people receive, process, and communicate and interact with their environment. There will probably be, the cause will probably be multifactorial. And I think it's going to be an interplay of how things come together. But I think it's very unfortunate in families where a child has autism, and to indicate that the mother or the parents did something wrong that caused this. The guilt with that would be tremendous. And in my opinion, it is completely unnecessary.
One thing that also came out of the administration yesterday is they're now recommending this new drug called Leucovorin as a potential treatment for autism. Can you tell us a little bit about the science behind that, why they're pointing to this drug that's typically used for chemotherapy treatment and pain management?
It's leucovorin, and it actually is a more naturally occurring form of folic acid. Folic acid has been important in pregnancy for years now. We know that it's related to neural tube defects, or the lack of it is related to neural tube defects. So we've always recommended folic acid during pregnancy. And in reality, what makes a prenatal vitamin prenatal than just a regular vitamin is the amount of folic acid. Now, I think many more studies need to be done on this. The main use of leucovorin is exactly what you say in people who take chemotherapeutic drugs, whether it's for cancer or whether it's for arthritis, and it can offset some of the side effects of that. But I think it's as the drug of treatment, I think much more needs to be studied.
Well, what do we know scientifically? And this is to Carol's and Jessica's question too. What do we know scientifically about the causes of autism?
Well, we know that there, like I said, it's multifactorial. We know that there are many genetic causes. In some of my own patients, when we've done genetic analysis, we found different gene mutations and deletions that we know are associated with autism. There are likely some environmental factors that come into play as well. But our concern about some of these studies that they base some of these decisions on, that they were poorly designed. They actually depended on a recall of patients about how much they took. And there's always a bias when you try to do recall. They had limited information on dosages and duration of exposure. So you really cannot draw scientific conclusions from such poorly designed studies.
I just want two things. Leucovorin, though, folic acid, I remember taking it in a big way. So it's not really something new.
It's not new. It's not new at all. We have learned so much about neural tube defects, which is a defect in the development of the neural tissue in the fetus. And we know that folic acid is incredibly important in the proper development of that.
So I want to follow, because we do know in the great reporting by our team of Brett Pulley, Jessica Nix, and Madison Muller, talking about these doctors at OBGYN practices in Atlanta fielding a lot of questions. I'm assuming you are fielding questions as well about all of this. I am curious, do you feel, or do doctors have a voice in Washington and are getting time with the HHS, Robert F. Kennedy, the secretary, or even with the White House?
I think we've had somewhat of a difficult time doing that. It seems to be recently that some of the scientific evidence is being ignored. I think that's very dangerous for patients. When patients come in and ask us about these things, it's shared decision making is what we call it, where we talk to the patient about the risks of not taking a certain treatment, a certain vaccination, a certain medication. We talk about the risks and we talk about the benefits of each. And patients, in consultation with their healthcare providers, need to make those decisions.
Well, speaking of some of this confusion that we're seeing coming out about Tylenol and autism too, a lot of pregnant women are now also looking at what do we do about a COVID shot? So how can patients look at all of this confusing messaging coming out of the administration that's in conflict with what medical doctors are saying, and how can they navigate this world right now?
Well, I think looking to your healthcare provider is the best place to go. I think relying on scientists, physicians, and healthcare providers to provide the best medical evidence and the highest quality medical evidence. We always say that we practice evidence-based medicine and that we do that. And as science changes, we change our recommendations. But science hasn't changed on this. I just think someone's statement on this has changed. And so we still recommend the COVID vaccinations. I had one myself. We still recommend flu shots during pregnancy. We still recommend the Tdap. And we're now recommending RSV, the respiratory syncytial virus vaccination during pregnancy.
One last question. Do we have to be worried that there's not going to be enough vaccines because there's kind of interesting messaging and messaging that maybe not everybody needs the vaccine?
Well, I hope not. That's always a concern. Supply is always a concern. We're finding patients coming in and requesting the COVID vaccinations, and we're having to send them out to pharmacies. And some pharmacies have them and some are not. Some patients are having to look for them in order to receive them. I've always been a believer. I am 63 years old, and I had the measles, I had the mumps, I had the chicken pox when I was a child, and I remember those. And I remember my sister looking at my face and saying, "What are those bumps on your face?" And that's how I was diagnosed. I received the polio vaccine when I was a child. And so I feel like I've lived a great life with the benefit of vaccinations. And I think, unfortunately, our memories are often short. And sometimes the younger generation doesn't realize the benefits of what they've had. I also remember the days of being an OB-GYN provider when the pandemic first started, and seeing, on our local TV station, seeing the freezer trucks outside hospitals in El Paso where they were placing the bodies of people that deceased from COVID. Hearing the stories of nurses that left Houston and went to New York to work, in some of these COVID units. I had several patients that did that, and it's gut-wrenching. And I really hope people will stop, take a deep breath, and really listen to the high quality evidence-based research that's out there, and pay attention to what your healthcare providers are telling you.